In this lab, we'll take a look at sutures, fontanelles, paranasal sinuses, and we'll take a look at the cranial vault and the floor of the cranium. So let's start by looking at sutures. Unlike your shoulder or your wrist or your knee, those joints are freely movable. These joints, a suture, are classified as an immovable joint. If we were to look inside, we'd actually see some fibrous connective tissue in there holding the joint together. So we want to take a look at a few of the sutures. The first one that we have over here connecting the frontal bone with the two parietal bones. Now I know we don't know these bones yet. You'll learn them in the next lab. But this suture right here, kind of going right along in the coronal plane, you're going to call the coronal suture. And then going between the two parietal bones here, connecting these two bones, this is the sagittal suture. And over here, the occiput is connected to the two parietal bones. We see the top of the rhomboid suture. We'll see that in another slide. This is it from on our skull bone or skull coronal suture here, and the sagittal suture. This is the posterior view, so you can see this is the occipital bone, or sometimes we say the occiput, connected to the two parietal bones. So this one going down like this and this is going to be our rhomboid suture. And again, here it would be from a posterior view. Another suture we want to do is called the squamous suture. This part of the temporal bone we're going to learn is the squamous part. If you remember from tissues, squamous means flat. So if you follow this squamous portion here all the way around like this is going to be called the squamous suture. And again, we can see over here the coronal suture from the side this time, and then we can see the rhomboid suture also from the side. Here it is on the real skull. So again, this would be the squamous portion of the temporal bone. And just following it around, that suture right there is the squamous suture. Now, in a baby, prior to the age of 6, there are two frontal bones. So a baby has a suture here known as the frontal suture. This, like I said, should close up by the age of 6, and then as an adult, we have one frontal bone. If that suture does not close, we call that a metopic suture. Right? That would be a persistent suture in an adult. So here's the fetal skull. You can see this line coming down right here. That would be our frontal suture. Again, only in a child, a fetus, a child, by the time of age 6, that should go away. So those were our sutures. Let's just define a type of bone that sometimes is found embedded in the suture. This is called a sutural bone. So if you take a look over here, this is the rhomboid suture. We're looking at it from the back. This is the sagittal suture right here. Excuse me. That bone right there embedded in the suture is known as a sutural bone. You could also call it a wormian bone. Right, they can be anywhere. This one, like I said, happens to be in the rhomboid. You can see them here in the sagittal suture. You can see them up front in the coronal. They really have no clinical significance. So on our model here, this is a big one, but this is the sutural bone that they're showing on this model here. So babies have soft spots, right? I'm sure you've held a baby before, and they said, be careful, the baby head is soft. What we're talking about are fontanelles. So here you can see this is a fetal skull. We're looking down on it from above, and you can see the sutures haven't fused yet. There's more fibrous tissue here, more fibrous tissue here. The soft spots that we're talking about, known as fontanelles, are these kind of larger areas where the sutures are going to meet. So the first one that I'd like you to know is called the anterior fontanelle, where the coronal suture meets the frontal suture and meets the sagittal suture. Right, this big intersection right here is known as the anterior fontanelle. A bit smaller right here is the posterior fontanelle. This is where the rhomboid suture meets the sagittal suture. Okay, here it is on the fetal skull. Again, you can see here's the frontal suture meeting the coronal suture, meeting the sagittal suture. This would be the anterior fontanelle. And then this one in the back where the sagittal meets the lambdoid is going to be your posterior fontanelle. Here's another view from the front. Now there's two on the side that we want to know. Where the coronal suture here meets the squamous suture in the front, right about here, this is going to be called the sphenoidal suture. And then if we follow the squamous suture back where it meets the lambdoid, this one here is going to be called the mastoid fontanelle. So here they are on a fetal skull. Again, you can see the coronal suture here. Here's the baby squamous suture right here. And where they meet right here, this is called the sphenoidal fontanelle. This bone right here is actually the greater wing of the sphenoid, so the sphenoidal fontanelle is right above it. Back here, where the squamous suture meets the lambdoid suture, this is going to be called the mastoid fontanelle, and then we're going to see down over here, this is actually the mastoid process that's going to form on the temporal bone. We'll talk about that in a little bit. All right, so from the side, sphenoidal fontanelle and the mastoid fontanelle. From above, the anterior and the posterior fontanelles. Now, some of our cranial bones, we're going to see the frontal bone, the sphenoid bone, the ethmoid bone, and even a facial bone, the maxillary bone, have these hollow cavities known as the paranasal sinuses. So what they did here is they kind of watermarked where we would find them. Para means around, and the nasal we know means the nose. So all of these sinuses open up into the nasal cavity, and the job of the sinus is to actually moisturize and humidify the air so that the air that we're breathing is not that dry. So this happens to be an X-ray. You can see here, there's two eye sockets, right, the orbits. But just check here. This is the frontal bone over here. We can see the whole frontal bone. On an X-ray, the bone shows up kind of as a white shadow, but air shows up as a dark shadow, as a black shadow. So if you look in the frontal bone over here, this dark area right here shows us that there's a sinus, and this is called the frontal sinus. Here's the other one on the other side. Here you're actually looking at the air in the nasal cavity right here. Then this is one, a lot of times we get like a sinus infection in our upper jaw known as the maxilla. So there's a big sinus here. But if you notice on this side, it's not as dark. The reason for that is this individual actually has a sinus infection. This is showing up as inflammation, and there's probably pus and that type of thing in there. So this is showing up a little bit cloudy where it should be nice and dark like that. So this is just showing us that we do have these air pockets in the bone, and these are known as sinuses. We'll look at a few of them in the cranial portion of this lab. The last two things I wanted to talk about are the cranial cavity. Sometimes it's called the cranial vault. On this sagittal section here, they took the brain out. So this whole space in here, all of this would be the cranial cavity or the cranial vault where the brain is going to sit. And on this model, we could see it real nicely, just a big cavity, and we can call that again the cranial cavity or the cranial vault. Finally, we'll take a look at the cranial floor. We're going to divide the cranial floor into three regions. Up over here, this whole area here, this is known as the anterior cranial floor. Sometimes we call it the anterior cranial fossa. A fossa is like a shallow depression. Then if we drop down, this whole area here going across over to this side, all of this is the middle cranial floor. You'll actually see it's lower than the anterior cranial floor. It's actually like a step down. Then finally in here, all this is another step down. This is going to be called the posterior cranial floor. And here it is on the real model. Again, anterior cranial floor would be all of this here. The middle cranial floor is a drop down a little bit, and here, all that's middle. And then if we go on this side of this little mountain ridge right here, all of this in the middle is the posterior cranial floor.